Hello, in this video we'll go over the chair-side lithium disilicate restoration workflow. Once the restoration is finished, prepare for scanning. Once scanning is complete, identify your margin, design your crown, and make sure to have adequate occlusal and proximal contacts. It might be important to add incisal variation in some cases. Start the manufacturing process for the crown. Make sure to pick an appropriately sized block that is also available at the dispensary. Press start to send the crown to the mill. Milling takes approximately 15 minutes to complete. Once the crown has finished milling, make sure to remove any remnants of the sprue on the crown. The crown can then be tried into the patient's mouth, making sure the margins, contacts, and occlusal contacts are appropriate. In this next segment, we will talk about the steps needed to crystallize the crown. The internal surface of the crown is filled with object fix. Insert the firing pin deep within the crown. Smooth any remaining object fix material away from the margins of the crown. Spray glaze may be applied at this point. Make sure that each surface of the crown receives an equal amount of spray glaze. Place the crown on the pin on the crystallization tray. Open the lid of the furnace. Select Speed Crystallization /Spray. Use the tongs to insert the tray and the crown into the firing chamber. Press the start button to begin the crystallization. Once the crystallization is complete, remove the tray and the crown and put them on the side of the furnace. With the crown out of the way, go ahead and close the lid of the furnace. After the crown has sufficiently cooled down, you may remove it from the firing pin. Water may be used to remove the object fix material from the intaglio of the crown. Dry the crown. It is appropriate to now check the aesthetics of the crown, making sure the shade match is appropriate. The following segment explains the steps needed to bond the crown to the tooth. Hydrofluoric acid will be needed to etch the intaglio of the crown. This is only obtained with a faculty member and used only on a crown and only in the lab. While wearing gloves, insert the hydrofluoric acid gel in the intaglio surface of the crown. Thoroughly rinse the intaglio surface of the crown, followed by air drying. Silane is used to increase the wettability of the crown surface for the cement. Insert a coat of silane onto the intaglio surface of the crown. Apply the primer to the surface of the tooth and agitate for 30 seconds. Then add a thin layer of cement to the intaglio of the crown. The crown is then cemented. Make sure all excess cement is removed, as well as any excess cement in the interproximal area. Make sure to take an X-ray to confirm marginal adaptation. Please remember that materials and techniques change over time. Make sure you're following manufacturer's instructions when cementing in the future.